So welcome everybody, and thank you for being here today and participating in the program. We're so excited about the program. We started it last year, and it's time to, connect together again and continue to bring in new participants. So I know we've got a nice mixture today that have registered. Some of you were in the program last year and continuing on. Some of you are just joining. And regardless of where you are, you're going to be just fine. If you're just joining, you're going to be, right on target to join into the program. So truly, we're excited to have everybody here and your interest in this program and what we can do together with it. So just in case you and I have not met before, I am Dolores White, and I have the pleasure of serving as the president for the KNA. And Eleanor, you want to introduce you?
I'm the CEO for the Kentucky Nurses Association, the Kentucky Nurses Action Coalition, and the Kentucky Nurses Foundation. And I've been with the KNA about, I'm going on 7 years now, and I don't have to work any days. We have fun. I love my job.
That's awesome. I love it. All right. Well, since we have such a small group, I'm just going to ask you all to introduce yourself and, just tell us your name and where you work and if you're involved in a position with the KNA. And if not, that's fine. But I'm going to start with you, Teresa. Introduce you.
Hello, everyone. My name is Teresa Villaran. I work for Fresenius in-center dialysis. I am chair of the Government Affairs Cabinet for the KNA.
Perfect. Thank you. And we're going to go over the priorities soon. That's Delanor's slide. So if you want to chime in, you chime in however you want. All right, Necia.
Thank you very much. I'm Necia Thornton. I work at University of Cincinnati Health. I've been there since 2009. That's right after I graduated from my BSN program. I've had other previous professional lives in high school education, mental health care in an urban setting, etc. I am a Northern Chapter member. I live in Campbell County. I am currently serving as the board's chapter liaison, which is awesome because it goes throughout the whole state. And so I'm learning, still very much learning about all the different chapters and the challenges they face, and then their particular opportunities, the things they have going great for them, and trying to be a conduit or channel between chapters so that people can share their burdens and their accomplishments and also get ideas flowing back and forth. I'm very much a techie kind of person. I'm sciences and humanities, all kinds of interest. So it's awesome to be here. One thing I've been so excited about, and I think that's part of what drew me to the KNA to begin with about 3 years ago, was the opportunity to be active in my home state of Kentucky with nurses and the possibility for being active on behalf of nurses and healthcare concerns in the legislature. That has been so great. I was able to be part of the first legislative and leadership fellowship that was held in 2022 to 23. Thank you.
Perfect. Thank you, Necia. All right, Stacy, you are next. Would you like to introduce yourself?
Sure. Hello, everybody. My name is Stacy Stanifer. I am an oncology clinical nurse specialist and an assistant professor at the College of Nursing at the University of Kentucky. So thanks for having me.
Wonderful. We're glad to have you. Thank you.
Tabitha Gannon. I've been a nurse for over 20 years. Just went back to school to get my BSN. Have been a member of ANA for quite some time now. I currently work as a nurse program coordinator at a federal facility in Lexington, Kentucky. I'm happy to be here. Thanks for having me.
Wonderful. We're glad to have you.
Is that a correctional facility, Tabitha?
No, it's a FQHC facility.
Got it.
I'm
Okay.
a pediatric program coordinator.
Thank you.
Very nice. If it was, she would have had another job for you.
Yeah.
We're seeking someone in that. Oh, I love it. All right. Thank you and welcome.
Thank you.
Thank you. Sarah, would you like to unmute? Yeah.
Hello, I'm Sarah Lynch. I am the Director of Risk Management and Patient Safety at Baptist Health Deaconess in Madisonville, Kentucky. I recently completed my master's in healthcare law One of the classes that I really enjoyed was the political advocacy class. And I felt like this probably would be right down my alley. I live in Muhlenberg County and work in Hopkins County, so would be interested in working with representatives from any of the areas that we serve here at Baptist Deaconess.
Excellent.
Wonderful. Thank you. Let's see, I have Jeanette next.
I'm having trouble. So I'm actually attending a winter conference at the Ridge in Lexington. So I'm in the lobby. So I'm having some technical issues, but I wanted to just make sure that I didn't miss this. But so I am a nursing instructor. I actually work for several different schools, one in Kentucky, University of the Cumberland. And so just excited to be here and learn more about what the program is. One of the things I learned about today here at the mental health conference that I attended is called a red flag law. So that's very exciting and something that definitely I want to talk to our legislators about. So just really excited to learn and to be a part of it.
Wonderful. We're glad to have you. Thank you.
Thank you.
Thank you. All right, Vanessa.
Hello, I'm Vanessa Fisk. I work in Louisville, Kentucky with Norton Healthcare. I work in clinical research and also part of our Kentucky Infection Prevention Training Center.
Wonderful. Thank you. Linda. I see Linda's iPhone.
Well, it might be me, Linda Thomas. I'm on my iPhone.
Okay.
And I've just been a member of KNA for 100 years and retired nurse educator. Participated in the Legislative Academy, the Legislative Leadership Academy, enjoyed that opportunity to develop some curriculum for that. I don't think I was available for the last one, so I thought I definitely wanted to be involved and just see what other things retired nurses can do.
Wonderful. Thank you, Linda. We're so glad to have you.
My name is Allison Jekyll, and I am a nurse educator in the Office of Professional Practice at U of L Health Peace Hospital, psychiatric hospital in Louisville. I went to the Nurses Day at the Capitol last year, really enjoyed that, and just here to see if this is something I can get involved in. Don't honestly have any experience with this, but definitely is an interest. So happy to be here.
Wonderful. We're glad to have you. And you don't have to have experience. This is where it starts. So we're glad to have you. All right. Renee.
I'm Renee Cecil. I am the chair of our River City chapter. So we just had our meeting and met with a couple of members afterwards about some great ideas for 2024. So I'm excited to be here. I love the work that you've done. I know as part of your project, but love to be here to support you and, be the voice of nurses from our chapter. And so I just actually spoke to somebody that has a very big passion for this as well. So I'll be sharing some of what we learn here and what we continue to talk about to our chapter, and as well as those who are supportive and interested in this great topic.
Wonderful.
For all you do.
Thank you. And thank you as well. And we appreciate you too. Well, again, welcome everybody. And thank you for being here today. And we're really excited to have your interest and hope you'll participate in the program. Delanor's going to bring up a PowerPoint and she and I are going to just go through a few short slides. We don't expect this meeting to be very long at all. And I'm just moving my screen around to where I can see everybody as Delanor brought up the PowerPoint. So on our next slide, we just have a very short agenda of a few things that we're going to do. We already did the welcome. We want to talk about legislative relationship building and the process of that and where everybody is. Let you know about Nurses Day at the Capitol this year, as well as the legislative conference. And then we're going to pull up the LRC and just show you a few resources on there so that you can get a little bit familiar with that website if you're not already. And then we're going to share the KNA priorities with you, and then talk to you about resources through the KNA, let you know events for the year, and then, of course, question and answers. So this is an informal meeting. If you have questions along the way, please just, unmute and come forward. Yeah, let us know which questions or comments that you have. All right, so just a little refresher, because again, I know some of you joined last year, some of you joined this year. And if you did not attend last year, we had training sessions early on in the year, and we went through the program in great detail, as well as Julie, our lobbyist. She went over quite a bit of information about Frankfurt and our legislative process here in our state and how to communicate with legislators. So it's really a great resource tool. And so those of you that were new to the program this year, I sent that to you this morning. You may not have seen the email yet. So I sent that to you so that way you'll have it as a resource. I know some of you have been in the program last year and you may or may not have been able to attend, but we did send the video out last year. So hopefully you were able to see it. If not, I will send it to you. Just let me know and we'll make sure you get it, because we're hoping that it'll be a resource. It's a fountain of information for you. But just as a reminder, we want everybody to, remember that this program is to leverage the voice of Kentucky nurses. And what we're doing is we are pairing KNA members with their state representative in the House or their senator to build relationships with and to promote advocacy and to serve as a resource for that person. Legislators are doing great work, and, they really want to make positive decisions for nurses in healthcare, as well as healthcare for healthcare providers, but then also healthcare outcomes, what patients receive. But many of them are not healthcare inclined. They don't have a healthcare background. So they really need to hear from nurses to better understand, our issues, our decisions, how we can share our expertise and our knowledge and our experience with them, because it can really help them make those decisions that impact us as nurses as well as healthcare. So, we do hope that you will decide, if you're not already paired, that you will decide to be paired with a legislator. Truly, participating in this program is only a few hours a year. It's not very much. So that's a year, not in a day or a month. It's spread out throughout the year to communicate with your legislator. And we do hope that you'll be able to attend Nurses Day at the Capitol, but certainly to build that relationship and serve that legislator as a resource. We provide you with talking points. Last year, those of you that were in the program, we sent you some information that Delano is going to go over as far as information about the KNA and information about nurses. But then also, as we promote our legislative priorities, we'll send you information on that as well. That's being developed as we speak. It's really an excellent way for us to continue with the promotion of the brand image of nursing and that all nurses are leaders. And so, again, we appreciate you participating in this program and being a voice for nurses. Currently, we have 68 members paired with legislators, and we're so excited about that. Our initial goal for Delano and I, it's like, let's set this initial goal, and we set it at 50, and we have 138 legislators. So we were really excited it was 168. But we want to continue to grow that and eventually get all 138 state legislators paired. And then we're going to move to the federal level and get those legislators as well. So we have goals.
We have goals. One of the things about this program, Dolores and I heard about it when we were at the ANA. We are like sponges. When we go to the ANA, we just cannot take in enough.
Yeah.
But one of the states said that they had a program like this, and they had 140 counties and they had 20. And we said, oh, we could do better than that. We set the goal at 50 and thinking that we might have to pull teeth to get 50, but to be at 68 and then to have 13 people register for today's program who did not have the opportunity to go to the previous program is so incredibly positive. Now, I have to say that this is a program that is a KNA benefit. It is not open to non-KNA members. And let me tell you the reason why. The KNA provides you with talking points, and we are your resource for getting answers. So, say, for instance, you're talking or you're having coffee with a legislator and they ask you a question. You don't know the answer. Well, you can say, I can get back to you. Then you can text Delano and she'll get it to you as soon as she can get it. But the point is that we are your resource, and for non-KNA members, they don't have access to that same type of information. So this is a KNA benefit.
Thank you, Delano. So legislator pairings, some of you are currently paired with your legislators. And again, as Delano said, we were looking at the roster. There are 13 of you that are currently not paired. And I did see after I sent that email this morning, a couple of you have already responded. I've just been in meetings and haven't got to look at it closely or respond back, but I will. So I'm asking you, if you are not currently paired with your legislator, if you can send me an email and let me know who your state senator and your state house representative is. And then I'll look at the roster, and if someone is not already paired with either of those, I'll pair you with one of them. And hopefully one of them will be available for you, because we do want to try and pair our members with their legislator, because then you're their constituent. With that being said, though, we want to pair all legislators. So if you are willing to pair with somebody else, that's fine. And we would love to make that happen too. So we will get you paired with the legislator. If you're not sure how to look up who your legislator is, if you're not familiar with it, I sent you the link for that. And all you have to do is plug in your address, and then you click on the results that come up, and you will see both of your legislators. And if you need help when you're doing that, just let me know. But use that link and you'll be fine to look them up and see. And now we're going to talk about the relationship building process. So we already talked about how important it is to serve as a resource, because, you know, they receive some information and they have so many bills to review, and they simply don't have time to do the research or reach out to the experts. So you're the nursing expert. And once you build that relationship with your legislator, they're going to be on a healthcare bill, and they're going to say, well, Renee's my KNA expert resource. I need to reach out to Renee because I need some information on this. So, you know, that's where we want to get, so that those legislators that you're working with and have a relationship with, and it's going to take time, we know that, but that they'll contact you. And then, as Delanor said, if you have the answers, absolutely share. But if not, Delanor and her team can get it for you. It's amazing. I can't tell you how many times I'll send an email. Do you have any information or data on ABC? And I get it. Okay. Definitely a fountain of resource information. It's there. You just have to ask for it. And legislators understand you may not have all the answers, but you have access to them. Right. So just let them know you'll get back with them. And then we want to make sure that you're, you know, advocating for nurses and healthcare and taking forward the priorities. And so in just a couple of minutes, Delanor is going to share those with you for 2024. When you are with your legislators, we just want to share with you, don't forget to stress who you are and that you're a nurse and what you can do for them, how you can help, how they can get in touch with you. Make sure they have all your contact information. Ask them how they prefer to communicate. Is email better for them? Some of them will give you their cell phone number. And certainly you can text and call them as they've deemed appropriate. And then, you know, just let them know you're the expert and to contact you, and you will build that relationship. So now I want to take just a moment and ask those of you that have been in the program a little bit, if you don't mind sharing your progress so far. And I know we're all at different stages of that. Some of you are still setting up meetings. Some of you may have met. Some of you may have known your legislator even before now. And then those of you that are just joining, if you happen to already know your legislator and you want to share that, you certainly can. I'm paired with my Senator Meredith, and I have spent some time with him. I shadowed him for a day in Frankfort and got to learn so much about the legislative process and what he does on a daily basis, and attended meetings with him all day long. He literally had one 15-minute section of his calendar open, and then ended up filling that up because some magistrates were in town that day. So he filled it up for that 15 minutes. It was an amazing opportunity. With your legislator, if you have time, and they will enjoy having you, you know, just ask to spend a couple hours with them and shadow them. It'll be a wonderful learning opportunity, but it also helps you build that relationship. So I encourage that if you're able to make that happen. But I had, beyond that day in Frankfurt, I've met with him via Zoom. I've talked to him on the phone. He was doing a fundraising event, and so I went to Litchfield to support him in that. And then while I was there, now I'm not paired with my House representative because, you know, we each have one legislator, but my House representative was there. So I took her aside for about 15 minutes and talked to her as well and shared our priorities with. So every opportunity that you can take it. You know, they want to meet with you. Some of them will want to meet with you for coffee, but whatever works for you. So Delanor is going to go next. That's our hand up. What do you have, Delanor?
I have two. I had the honor of being, Jason Nemes is my person. Mm-hmm. And I got an opportunity to call him and tell him that he was voted as the Citizen of the Year for the Kentucky Nurses Association. And he was speechless. I mean, he was just speechless. And so he is just so incredibly proud. And he said, my mom is a nurse and I get to tell her that I am the Citizen of the Year because, all the things I've done to support nurses. The second one I want to tell you about is Dolores and I had breakfast with Senator Berg. That was so incredibly informative. And it was so interesting because we went to hear about what her priorities are so that we could see if we could support her. And she wanted to know first off the bat, what can I do for you? What do I need to know about what nurses need? Now, she's a physician, but she still knows that nurses have the answers. And so she was really focused on us giving her what we needed from her. So I was very pleased. Were you pleased as well, Deb?
I was absolutely, yeah. Can't wait for our next meeting. It was just.
I know.
Yeah, we need to do it again. Thank you, Deleanor. Is there anybody else that would like to share? If so, please just unmute.
I'll go.
Thanks.
So I'm here with my senator and she's fairly new. And I already have a meeting set up with her for Nurses Day at the Capitol. But I also have had a relationship with my House member, Killian Timoney. And I follow him on social media and I've met with him several times in his office. And you know how a lot of them send out just kind of like form letters of what they've done, for the session and everything. So he sent me the form letter, but in handwriting, he put on there, that we don't always, agree on everything, but that he appreciates me listening to his side of the story. And I just thought that was a great example of how you build a relationship with your legislator.
That is fabulous. Yeah. Thank you for sharing that, Teresa. Anybody else?
I can comment on mine. This is Nicia Thornton. I am paired since last year, 2023, with my state senator, that's Shelley Funke Fromeyer. She covers Kimball County, where I live, and I think a little bit of some adjoining areas. It was really great to meet her. We met periodically at coffees here in Kimball County. Last year on Nurses Day at the Capitol, I had a chance for a brief in-person meeting with her. And then she invited me to come to the Senate session that day. And she was awesome about recognizing Nurses Day at the Capitol in front of everybody and introduced me. She has a lot of family members who are nurses. And one of her own concerns or causes is birthing centers in the state of Kentucky. So that's been terrific. I find her to be a very intelligent person. We have some matters that she is welcoming my educating her on or sharing with more information to her that are things that she voted against or opposed this past session. It was her first session as a legislator, 2023. So I've really appreciated the opportunity to see how much a person who starts their term of office has to learn and digest, and how busy and overwhelming that could be. That's really helpful because the things about which I would say, don't agree, it's kind of given me a view of her humanity, that she's trying to absorb a lot of stuff. She's really trying to do a good job. And the fact that she was open to continue talking to me and listening to me, even though we have that very significant difference, I think that says a lot. It really does. Thank you. This has been awesome, and it'll be continuing.
Wonderful. Thank you, Nicia.
I do think that says a lot, and we're not going to always agree with our legislators, and they're definitely not going to always agree with us. But I think the important thing is that they're legislators for all the people, even the people they don't agree with. And so helping them to develop a different perspective is part of our role as nurses. And as long as we're not combative and we're not trying to punch them out or anything, most they'll listen to what we have to say. And in many cases, they may learn something. And maybe it might influence them to change their viewpoints. But if they don't have any way to get anything new and different, then they don't have an opportunity to adjust or change a viewpoint.
Right. They need
Those
to
are
hear.
great. Those are great points. And the thing too, that it was one of the guides that we were given when this program started through Dolores was look for what you have in common. You just never know.
You never
And
know.
so the fact that my senator has nurses in her family, and then of course that we're both living in the same area of the state, there's something there. And as was mentioned, it might be that there's connections at schools. If you both have children, maybe they go to the same schools. So I think looking for any way to make a connection where you're both human beings to each other, and then with that foundation laid, you can get into stuff that's more sensitive territory.
You're right. You build on that. That's how you build your relationship. Very good. Thank you for sharing. All right. Is there anyone else that would like to unmute and share anything? Perfectly fine. And again, if you've not been able to connect with your legislator yet, that's perfectly fine. That could be your goal for this year to hopefully make that meeting happen. And start with an email. You know, that's an easy way to start. All right, we're going to go on to the next slide and just remind you about Nurses Day at the Capitol. I know we've already mentioned it a couple times, and I know you've seen it in K&A publications, but we hope you can attend. It's certainly not a requirement to attend to participate in this because we understand work schedules in life, and you may not be able to make it, but we hope you can, and it's going to be an amazing day of meeting with legislators, gaining their support, sharing our priorities, professional development, and networking. And the agenda, Teresa, I'm going to put you on the spot. Is there anything you'd like to say about the fabulous day planned? She and her team have worked very hard on that. So it's still much work to do between now and next month. But you want to share anything?
We're going to have our lobbyists speak. We're going to have legislators speak, both House and Senate. We're going to give you time to meet with legislators because we really think it's important that you make this one-on-one contact with legislators. And, you know, if you don't want to go by yourself, please reach out. We can always try to find somebody to go with you. And it's just going to be a fun day of learning. A lot of students attend, and we really think it's important to, you know, start students thinking about how legislation affects their practice, affects their patients' lives. So it's a really, really interesting day for students that we hope will carry into their practice. So we hope that you all will attend. It will be a great day just to get together, talk amongst ourselves, but talk with our legislators, show them that there are over 90,000 of us in Kentucky. They really should listen to us because there are so many of us. But more importantly, that we can be, you know, someone that they can reach out to if they have a question on a bill. You know, how might this affect their constituents? How might this affect nursing as a profession? That they know they can reach out to us and we can help them answer those questions.
We have 129 people registered as of this morning, which is wonderful. It's the highest number we've had. We're shooting for 200 this year. So if you haven't signed up, please do. When you register, there's a video, a PowerPoint that Teresa and her team put together that is absolutely positively wonderful. We're going to be in the House chamber like we were last year, which was wonderful. It's a little chilly. And we will have a microphone this time, Teresa. We will. I got it fixed. And we are going to be doing something a little bit unusual. We have a room where legislators are going to be coming by to talk to us, House and Senate senators. And then so that we don't have to do all the running around. They get to do all the running around this time. Also in the afternoon, there is an opportunity for you to go to the House and the Senate to observe. And usually one of the observations is a resolution to honor Kentucky's nurses for that day, which is kind of wonderful, actually. So it should be a pretty exciting day.
It truly is. It's inspiring. I hope you can make it. Thank you both for sharing the information about it. And then to build on Nurses Day at the Capitol is our legislative conference. We had our first conference last year, and it was an amazing day. It built on, professional development, legislative support, and again, networking. We were in person and just had an amazing day. And, I tell everybody that it was so good. I remember Delano and I looking at each other. It's like, well, how are we going to beat this next year? And I tell you what, the team is beating it for this year. So the agenda is amazing. We have Dr. Ernest Grant, the immediate past president for the ANA. He is our keynote speaker, and he is a wonderful professional nurse and human being. So you are in a delight to meet him. We have Healing Politics attending. And if you're not familiar with them, they are a resource for nurses. Their goal is to get more nurses in legislative positions, and they are a fountain of information. They're going to come share with some with us. We're building on media training. We started with some of that last year. And it's a wonderful opportunity for all of us to help improve in our communication with each other as professional nurses and colleagues with the healthcare team. But also, if you ever have the opportunity to speak in front of the media, it's very helpful for that as well. So that's just a little glimpse of the day. Teresa, Delano, you guys want to add anything else to it? It's going to be amazing. We hope you can make it.
Well, all I can say is if you haven't been with us at Nurses Day at the Capitol, you have missed out. And you don't want to miss out again. So whatever you need to do to change your schedule even if you can just come for the first part of the day, I think it'll be well worth your time. We will have some vendors. The KNA will be a vendor there, of course, and we'll have KNA swag for you there as well. We will have folders for you that will have the KNA priorities for advocacy for the year. So you'll have something to take home to prove that you were there and you had an incredible experience.
Absolutely. Now the folders are for Nurses Day at the Capitol, right? Not the conference.
Oh yes, I'm sorry. Nurses Day at the Capitol. Yes. Yes, that's what they're for.
Yeah. Okay. So come get those resources. Teresa, do you want to add anything else or?
Yeah, I just want to say that for the legislative conference, it will be at Galen in Louisville. Yeah. And I think it's a way for nurses to, realize how important being involved with advocacy is for our profession, for the state of Kentucky, for patients. And even those people who aren't patients yet, they will be patients, thinking about, the social determinants of health and how we need to look at bills that impact people's social determinants of health. And negatively impact those. So I think the legislative conference in May is a really good meeting to help nurses understand the importance of their own advocacy.
And one of the things that we'll have at the legislative conference is a report out with Teresa and our lobbyists about legislation and bills that happened during this session for this year. So it'll be kind of a summary so that you'll be able to hear and ask questions about, well, what about that bill? Or what about this bill? So if you haven't thought of coming to the legislative conference, put that on your agenda as well, May 17th.
One more thing I want to say is when you're looking at all these 200, 300, 400 bills that are coming out of Frankfurt, a lot of them, their names sound really attractive and they make you sound like you really want to support them. But once you dig deeper into them, you see how harmful they actually can be to communities. So make sure it does take time to read some of those bills, and a lot of them have terminology up front, and you go about 3/4 of the way through and finally you get to the bill. But it really is important to read those bills because they, do impact people that are here in Kentucky and populations that we care for.
What's that?
It's such an important point, Teresa. It really is.
Yeah,
There are things are hidden in those bills.
they
Yeah.
are. Yeah, and it could be just one little sentence. So yeah, very good. But that's one reason why the Governmental Affairs Cabinet and our lobbyists and us, we are working for you to help review those. So it's a lot of work, but it's great research that the Governmental Affairs Cabinet does. When you go to the Kentucky General Assembly website, this is the homepage, and it is a fountain of information for you. And I encourage you to look up information about your legislators, particularly. You can certainly look at any legislator, but particularly look up the legislator that you're paired with so that you can learn more about them to help build that relationship. So when you come to this legislator tab, you can go to House or Senate, or you can go to all legislators. But if you're paired with your senator, you might as well just go to Senate. And then it brings them all up. So you can just, find them, pick wherever they are. So again, mine just happens to be Senator Meredith, and it tells you if they're Republican or Democrat and what district they're in immediately right there. But when you click on them, it brings up their profile so you can learn a little bit about them. So, this just very briefly gives his profile and then how long they've been in service, what committees that they are serving, as well as their caucus. And then over here is their contact information. So that's how you can email and call their office as well. You can email just through here. And then you can also pull up this little tab here and look at what bills your senator is sponsoring and read them through pretty thoroughly, because if you talk to them next time and you specifically talk about their bills, they're going to appreciate that. So that information is there. To learn more about the committees, let's say, like he is the chair of health services. And if I wanted to learn a little bit more about that, I could click on it here, but also any committee you can find up here. But let's just say I want to know a little bit more about health services. I can see who else is on this. And then it brings up the calendar. So, if you're ever able to go sit in on one of the committee meetings, that's fabulous as well. The materials for the meetings, it's really a fountain of information. I can't say that they're enough. The bills. To be able to look up bills, you could go to this session and see what bills there are. You can go here and find a bill if you know the title or topic of it, or if you know the number. So like we could look up House Bill, what is ours, 159? And see if they have it.
Or you can do keywords.
Yeah,
so
if you know the topic.
Mm-hmm.
Yeah, and that's not it. That's back from 23. No.
Oh, well, you have
They
to
don't
check.
have 24 uploaded then.
You have to do 2024. Is it uploaded?
Yeah, well, I did that. I hit.
There it is. Record session.
Yeah, I don't know that they have. I guess they just haven't
It
uploaded
hasn't
them up
been
into the
heard
bill
yet.
watch. Yeah, because it's so early in the session. But shortly, you're going to be able to do that for 24. They don't have 24 loaded yet. But you just put in the bill number, or do a search of it. You can search the whole session and find the bills. But like Teresa said, you're going to be able to pull those up and look over them. This is a fountain of information for you, and pull up and take time to peruse and learn about your legislator and the information that'll be helpful to you.
Okay, so every year the GA cabinet meets and they take into account what's going on in the environment, and they decide and recommend to the board what should be the priorities for legislative and other advocacy issues. And so there are three that are the highest, well, actually all four of them are high priorities. So workforce support, which is safe staffing, and that's looking at committees. I know that we will not have a legislative ask this time for that, but we are working with hospitals and long-term care organizations to look at how nurses can participate in staffing in their organizations. And we are not looking at staffing ratios. We are looking at how nurses can be part of the staffing solution. Did you want to add anything, Dolores or Teresa, on that?
No. Nurses
Okay.
having a voice in safe
have a voice.
staffing and, for their outcomes and patient outcomes.
Right. And that's the reason we're not looking at staffing ratios,
Mhm.
because they don't work. But there does need to be an opportunity for nurses to be part of the decision making. We're also looking at decriminalization of healthcare workers. We initially started out looking at just nurses, but you know what? There are other people in the healthcare system who need those same type of protections. And we're looking at this as a bill that says if systems don't work, that the healthcare provider is not holding the bag, saying that they were doing something that was really bad. Then we have the school nurse initiative, which is school nurses in every school all day, every day. And then last but not least, to look at the brand image of nursing and nurses and what we need to do to support that image, which will also impact retention and recruitment of nurses.
And these priorities that Delanor just went over, as she mentioned earlier, you're going to get a packet with tips on talking points on all of that.
Absolutely. Because we want to make sure in our communication with legislators and other people that you are on the same wavelength of what KNA is focused on. I want you to know that we are here to support you for this nurse legislator engagement program, and actually all the time. I mean, that's what the KNA is all about, is supporting its members. But we are there to answer your questions and provide you with information and resources, whether it's sending it through text or sending it through email, putting it on social media. We are here to support you. I can tell you that I've had people to be in committee meetings texting me saying, they're talking about this. What about that? Do we have numbers on that? And being able to be responsive enough for them to respond in a committee meeting. So it is really important to plan ahead when you're going to be talking with your legislator, or if you're going to even attend a committee meeting, just to sit in the audience and learn. But on our website, we have fast facts about the KNA. We have fast facts about nursing. You can bring them up from the website, print them out, carry them with you, and you can talk to your friends about it. You can talk to your family about it. But these are many things that people just don't know about nursing, or they just don't know about KNA. One fast fact that I love telling people is, of course, we have 90,000 nurses, but did you know that we are 53.3% of the healthcare workforce? Those are on these documents that once you become very familiar, you won't even have to carry your documents. You'll be able to talk to people about those kinds of things. If we are 53.3% of the healthcare workforce, and we are the largest profession in the United States, and certainly in Kentucky, people should want to hear from us. And we need to develop the confidence to be able to say, I know you want to hear this. I know you want to know about this, and to be able to give them that type of information. We have history, especially in the last 6 years, of focusing on social justice issues. And as Teresa was talking about, social determinants of health and how it will impact health care that individuals receive. The KNA is all about how do we do that and support our patients and the nurses. A couple of other things that are in the nursing facts is that in the Gallup poll for the last 21 years, the nurses have been identified as the most trusted profession in the world, not just in Kentucky or not just in the United States, but in the world. There are 5 million nurses in the United States now. That's the new number that the ANA is using. And nurses in Kentucky provide service to over 80 different practice areas. Did you know that? 80. Nurses do some of the most incredible things. People in general don't know that. Nurses don't know that. In Kentucky, we are projected to be at least 20,000 nurses short by 2025. That's next year, people. We need to get focused on how we elevate the image of nursing so that that will impact the recruitment and hopefully the retention of nurses. The average age of a nurse in the state of Kentucky is 55 years old. Now, what that means is they are close to retirement. And if they're not being treated well and they don't want to stay, they're going to retire. And that wisdom goes out the door. So we have to do our part with the KNA and as nurses to get nurses to stay in the profession and keep that wisdom so that we can train the nurses who are coming behind us.
We also have to make sure that recruitment is up to the standards that we hold of excellence. And
Absolutely.
I think sometimes that we're willing to take whatever, which floats right down to the patient and impacts patient care. So we've just got to retain that high standard that we have and recruit the nurses that are going to be taking care of us.
I definitely agree, Linda, but let me say this. I'm sure you all remember Senate Bill 10. Well, the legislators didn't ask us what would work and how they could help with the nursing shortage, but they meant well. But let me tell you how hard it was on the back end to get some of those things changed, because they thought bringing in foreign nurses who didn't take the NCLEX and who couldn't speak English would help us with the nursing shortage. They really didn't understand until we stood up and said, okay, there are a couple of things we'd like to share. And when they talked about decreasing the qualifications for professors and instructors, you know, they really, and I have to believe they were trying to help us, but without knowledge. And that is why this program is essential. We need to help them before they write the legislation. And if we have relationships with them, they will ask us as they are thinking about it. A couple of things that we do that most people don't know is we vet and recommend appointments to the Kentucky Board of Nursing. We have 7 seats that we can recommend to the governor to appoint to the Kentucky Board of Nursing. But you have to be a member of the KNA in order to benefit from that opportunity. So what I'm saying is that on our website, we have this information and much more that will be easy reading for you to become very informed about nursing and very informed about the Kentucky Nurses Association.
Exactly. And you can take those notes with you when you go talk to legislators. So they understand you're going to have notes. They don't expect you to have it all memorized.
That's for sure. So I know that we're running out of time, so I'm going to run through these upcoming events quickly. We've talked about the Nurses Day at the Capitol. It's from 9 to 2. Sincerely hope that you will join us. We talked about being focused on social justice. We have had social justice movie night for 3 years. Is that right, Teresa? Since you were the person who wrote the proposal for us to start social justice movie night. Is it 3 years? Yeah. So our next one is on incarceration. It'll be February the 22nd, and it'll start at 6 p.m. We're going to be watching the movie 13th and then having an expert panel to discuss incarceration in Kentucky. We have our legislative conference we've mentioned, May 17th. Nurses Month is May, the entire month. We have our license plates that are available now. You'll just need to contact your county clerk and ask them to order the Kentucky Nurses plate. They'll cost $40, $10 of that, $40 will go to our foundation so that we can give scholarships to our students. We have tremendous amount of CE opportunities. We have a learning management system. It is up 24 hours a day, 7 days a week. And the Nurse Legislator Engagement Program meeting, we are here. What questions do you have?
Yeah, what questions do you have for us?
I just want to say one other thing, especially for the nurse in every school, every day. Your legislators are going to tell you they don't have money for that. However, we do have a surplus budget here in Kentucky. How we choose to invest that is up to our legislature. So you can call right now and ask them to help fund a nurse in every school every day. We're asking them to do it for a year, and then hopefully we can put processes in place where it could self-fund through a Medicaid program, et cetera.
Exactly. What better resource outcome should you have than the health of Kentucky children, right?
They are our future.
They're our future nurses too.
There you go. There you go.
So, all right. Well, if you don't have questions now, we understand you're on the spot. But if you have some later, email us. And if you're not paired with a legislator, please send me that information. I'll get you connected with your legislator. We'll get you paired and we can move forward. Again, thank you, everyone. Have a great rest of your day.